Hi everybody, welcome back to my channel. Let's talk about sleep. I'm Dr. Daniel Barone. What I wanted to do today was a quick video on an oral device for sleep apnea, aka a mandibular advancement device. If you remember from my video on obstructive sleep apnea, what's happening is the airway is closing off right here, right behind the tongue. And what happens is when the airway becomes small like this, so this is when somebody's awake, this is what happens when they're asleep as the muscles relax. When it goes to this, air is able to still get in and out of the tissue, but the tissue is now vibrate, that's snoring, and then what happens here is apnea, stoppages of breathing. So the point when we talk about obstructive sleep apnea is to open up the airway. Now, if you remember from our CPAP video, what CPAP is doing is pressurized air going in and forcing the airway open, kind of like an airway splint. With a mandibular advancement device or an oral device for sleep apnea or a dental device for sleep apnea, what these do is they're kind of like molded to the upper and lower teeth, like a sports mouth guard, for example. And what happens is they pull the lower jaw forward. What that does, when you pull the lower jaw forward, you're taking the tongue and the soft tissues away from the back of the throat. That again opens up the airspace and allows the air to flow through. Now, when somebody has diagnosed sleep apnea, either through a home test or an in-lab test, what I usually do is I send them to a dentist who creates these devices. Many dentists do nowadays. It's always best to find somebody who kind of specializes in this kind of work, but many dentists do them. And that's important because when you put one of these oral devices in, there is a lot of pressure on the teeth and the bite and the jaw and all that, and that can disrupt dentition over the long term. But for the most part, though, these are considered to be safe for most people. And again, you're pulling the lower jaw forward, so it really takes somebody who's going to know, all right, what's the best position for the oral device to be in as far as where the jaw should be to allow everything to be pulled forward without putting too much strain on the TMJ, the temporomandibular joint right here. Okay? These devices, though, they can work. Usually what I do is I use them for mild to moderate cases, so that's if somebody has an apnea index going up to about 25 or up to 30 per hour. When we get into the severe range, usually I try to get people on CPAP. Although I have seen cases where somebody has had severe sleep apnea and they were fully treated with an oral device. But typically we don't do that for in those situations unless somebody just can't tolerate or doesn't want CPAP. So yes, oral devices are good. They're a great alternative. The problem with them is, as of the time of this video, insurances don't always cover these. And these can be kind of expensive depending on the quality of the ones that are made. We're talking $1,000, $2,000, $3,000 in some cases. So, that can be kind of pricey. Not necessarily at once in one shot, but over, a payment plan or so, but still can be expensive. And they are typically used for about 5 years or so, similar to CPAP, and then they would have to be replaced or revised and whatnot. So imagine if we walk through this, somebody comes in for a sleep test. Someone comes in for a sleep test. We diagnose them with, let's say, moderate sleep apnea. I send them to a dentist. The dentist makes a device. That usually takes a few weeks before the molds to come back and all that. And then we retest them to make sure that the device is working after it's been adjusted and the dentist is happy and the patient is happy. And once we know that it's working for the apnea, then I just tell them to continue on. Now, what's unique about an oral device compared to CPAP, let's say, for example, is that we really can't measure compliance and effectiveness over time. Somebody comes in on CPAP, I can see how they're doing with the machine, lets me know, okay, Mr. Jones is using it 8 hours a night. The apnea number has gone down from 35 down to 2. They're doing great. The oral device, we don't have that capability. So we do these, the sleep test after they've had it made, and we're going to assume that it's continuing to work if they don't lose or gain or lose a lot of weight, because that could change the numbers by itself. Every now and then we'll do another test just to make sure that it's still working. But yeah, but these can be a good alternative for people who are having trouble with CPAP or just don't want to do it. Now, I want to mention just one other thing. There are over-the-counter ones or over the internet ones. Two companies that I've seen are called Snore RX and Zepper or something like that. What these are, they're all similar in that they're boil and bite devices. So that means you mail away. They're probably about, I don't know, $50, $100. You send the money, they send you a kit, and basically you put this in boiling water. This kit in boiling water softens up the plastic. You put it in your mouth, and you get it kind of gets molded to your own teeth, and then from that point forward, you can use it in much the same way as I just mentioned, where it pulls the lower jaw forward. Now, these are not going to be as tailored to somebody's bite as an oral device made by a dentist would be, obviously. And what I usually recommend these for is somebody who's snoring. Somebody who's snoring and they've been diagnosed or they've been tested and they do not have sleep apnea or very, very, very mild sleep apnea. Anything when we get into the mild to moderate range, I would not recommend this. But if we do a sleep test, we find the person does not have sleep apnea, I would say, look, if you want to try one of these inexpensive alternatives, you can certainly do so. And that's usually a good way to help with snoring. We'll talk in another video about what to do just for simple snoring, but what I always tell everybody is if there is snoring and you're not sure if there's sleep apnea, get tested because you don't know. I have people come into my office say, I swear that they do not have sleep apnea, and we do a test and they do. So it's important for your health, it's important for your sleep health, it's important for how you feel. So what I always tell everyone is if there's any doubt, get tested. So that's dental devices for sleep apnea. Like always, please subscribe to my channel, like this video. If you have questions or comments, please leave them in the comment section below. I will try to answer any and all questions that come to me. And I'll see you guys in the next video. Thanks a lot.